Families whose children were treated by the suspended surgeon Kuldeep Store at Addenbrooke's hospital in Cambridge say senior managers should leave or be sacked after an independent report found several failings. Joining me now is our health correspondent Laura Bundock. Laura, tell us more about this situation.
Well, this report was commissioned following the suspension early this year of Kuldeep Store, who worked as a paediatric orthopaedic surgeon here. The aim of this report was to find out whether there were missed opportunities to identify issues with some of her surgeries earlier, and its findings are damning. It was released to some of the patients and families last night, and we've seen a copy of it. And a lot of this report is examining a report that was published nearly 10 years ago in 2016 into Kuldeep Store, which highlights errors, technical errors and issues with some of her surgeries. That report from 2016 was then sent to senior managers who simply didn't act on it. And today's report, which will be published in the next few minutes, is critical of this. It said that managers miscommunicated, they misinterpreted, they misunderstood that report all those years ago, which meant that deficiencies in Miss Store's practices were not identified, and that resulted, it says, in a prolonged risk to patients. It also points to wider issues with the system and the culture here at Addenbrooke's Hospital, which is a world-leading hospital. Now, we caught up last night with some of the families who've been impacted by this. They were reading the report when we were there, and they are not happy with some of its findings. Lynn Harrison's daughter, Tammy, had 3 operations with Kuldeep Store. The second 2 didn't work, leaving her daughter, who's now 13, in constant agony. Here was what she told me last night.
And apologies not enough. They're only apologising now because they've been found out. If it wasn't for the whistleblowers, they would have carried on. Either leave or be sacked, because I will not rest until him and the rest of the board have gone. Because I can't put my trust and faith in that hospital when it comes down to my child.
A lot of anger from families. We've had a statement from Roland Sinker, the chief executive here, who said, "We are deeply sorry for the impact this incident has had on our patients and their families. This should not have happened, and we are committed to making changes so it does not happen again. We remain focused on supporting our patients and families throughout this incident, and this is why we've given them advanced access to the report and are holding dedicated briefing sessions on the day of publication. As well as this, we recognise the need to be totally transparent about the findings of the investigation, so we're publishing the report in full on our website alongside an action plan which sets out how we will address the investigation's findings. Following the publication, I will meet with patients and families to hear their views and ensure their feedback shapes the delivery of this action plan. If anyone affected has any concerns or questions, I would urge them to contact me directly to discuss." And for many families, though, that simply isn't enough. They're questioning why the chief executive, who was in his position back in 2016, didn't know about this report, or if he did, no action was taken to do something to prevent the surgeon from having the training that was recommended in that report given to her to prevent future harm to some of their children. They're questioning why it's only now that the chief executive is inviting them to come and speak with him, and they say it's simply not enough. It's gone on for too long, and they are calling for all those at the very top of the management here to resign.